RAFT-AF trial checked whether ablation-based rhythm control improved clinical outcome in patients with heart failure and atrial fibrillation compared to rate control. It was a multicenter, open-label trial with blinded outcome evaluation using a central adjudication committee. Persons with high burden of paroxysmal AF of more than 4 episodes in 6 months or persistent AF of less than 3 years duration and heart failure were included. Heart failure was New York Heart Association class 2 to 3 with elevated NT-proBNP. The study had enrolled 411 patients, of which 214 were in ablation group and 197 in rate control group. Primary outcome measured in the RAFT-AF trial was a composite of all-cause mortality and all heart failure events with a minimum follow-up of 2 years. Secondary outcomes measured in the trial were left ventricular ejection fraction, 6-minute walk test, and NT-proBNP. Quality of life was measured using the Minnesota Living with Heart Failure questionnaire and the AF effect on quality of life. RAFT-AF trial was stopped early due to an apparent futility by the Data Safety Monitoring Committee. The final report concluded that in patients with high AF burden and heart failure, there was no statistical difference in all-cause mortality or heart failure events with ablation-based rhythm control strategy versus rate control. But there was a non-significant trend for improved outcomes with ablation-based rhythm control. Interestingly, a meta-analysis published in January 2019 had concluded that catheter ablation was superior to conventional drug therapy for improving all-cause mortality, heart failure hospitalization, LVEF, 6-minute walk distance, VO2 max, and quality of life. They also mentioned that there was no statistically significant increase in serious adverse events. But they had mentioned in the limitations of the analysis that the results were driven primarily by one clinical trial, possible patient selection bias in ablation group, open-label trial designs, heterogeneous follow-up lengths among trials, and lack of patient-level data. But AMICA trial, which was published in December 2019, was also terminated early for futility. In the AMICA trial also, catheter ablation did not show any benefits in patients with AF and advanced heart failure. LVEF increased in ablation patients to a similar extent as with best medical therapy. AMICA trial had 68 patients in ablation group and 72 patients in medical therapy group for final analysis. The study had enrolled patients with persistent or long-standing persistent AF and LVEF of 35% or less. Primary endpoint was an increase in LVEF from baseline at 1 year. Secondary endpoints were 6-minute walk test, quality of life, and NT-proBNP. Best medical therapy was rate control, and all patients were discharged after index hospitalization with cardioverter defibrillator or cardiac resynchronization therapy with defibrillator implanted. Device recorded AF burden was lower in the ablation group 1 year. Pulmonary vein isolation was the basic ablation strategy. First set of journal references. One more journal reference. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.